Hello and welcome, dear viewers. In today's video, we will talk about a serious but often overlooked health issue, echinococcosis. More specifically, we'll focus on alveolar echinococcosis, a dangerous parasitic disease that can be life-threatening if not detected and treated in time. Why is this topic important? Because echinococcosis can silently grow in the body for years and severely damage vital organs like the liver, lungs, and even the brain. That's why understanding this condition and recognizing its early signs is crucial for protecting your health and your family. Make sure to watch this video until the end. Every minute is filled with medically accurate and useful information that could make a big difference in your life. If you'd like, I can also write the video outro or help with thumbnail ideas for this topic. What is alveolar echinococcosis A? Alveolar echinococcosis A is a chronic, progressive, and potentially fatal parasitic disease caused by the larval stage of the tapeworm, Echinococcus multilocularis. This disease primarily affects the liver, forming tumor-like infiltrative lesions that can mimic malignancies and gradually spread to other organs such as the lungs, brain, and kidneys if left untreated. Life cycle of the parasite. Definitive hosts: foxes, wolves, dogs, cats, in which the adult tapeworm lives in the small intestine. Intermediate hosts: small rodents like voles and mice, where the larval cysts develop in tissues. Accidental host: humans infected by ingesting the parasites. Eggs through contaminated food, water, soil, or contact with animal fur. Once ingested, the eggs hatch in the intestine, releasing oncospheres that penetrate the intestinal wall and travel via the bloodstream to the liver, where they form multi-chambered alveolar cysts. Pathological features: A is invasive and infiltrative, resembling malignant tumors. In the liver, it forms multilocular cysts filled with gelatinous fluid and surrounded by fibrous tissue. The lesion slowly destroys healthy liver tissue, obstructs blood vessels, especially the portal vein, and may spread to distant organs through hematogenous dissemination. Calcification and necrosis are often present in older lesions. Clinical course: the disease develops slowly, often over 5 to 15 years, and remains asymptomatic in early stages. Symptoms often appear late and may include abdominal pain or discomfort, jaundice, hepatomically enlarged liver, weight loss, fatigue. Misdiagnosis as liver cancer or cirrhosis is common due to the tumor-like nature of the lesions. Morphology and imaging: ultrasound and CT, MRI imaging typically show an irregular mass in the liver with microcystic or sponge-like appearance. Calcified areas, necrotic zones, and infiltrative borders are typical findings. Lesions often lack a defined capsule, helping differentiate from hydatid cysts caused by agranulosis. Epidemiology and risk factors: A is endemic in northern and central Europe, Central Asia, China, Japan, and parts of Alaska. Human infection occurs from consuming unwashed wild berries or vegetables, drinking contaminated water, close contact with infected dogs or wild animals. Rural populations and farmers are at higher risk. Conclusion: alveolar echinococcosis is a life-threatening parasitic disease that behaves like a malignant tumor, caused by Echinococcus multilocularis and transmitted via contaminated food or animal contact. Difficult to detect early and often diagnosed when advanced. Requires early detection, complex surgical intervention, and long-term antiparasitic therapy for effective treatment. Causes of alveolar echinococcosis A. Alveolar echinococcosis is a chronic parasitic disease caused by the tapeworm, Echinococcus multilocularis. It primarily affects the liver and can be life-threatening if left untreated. The infection occurs when humans accidentally ingest the parasite's eggs, which are spread through the feces of infected animals. 1. Contact with wild animals, foxes, wolves, and other wild carnivores are the definitive hosts of Echinococcus multilocularis. They excrete the parasite eggs in their feces, contaminating the environment, soil, plants, and water. 2. Transmission through domestic animals, dogs, cats. Domestic pets, especially hunting dogs, can become infected by eating small rodents that carry the parasite. These pets can then carry the eggs on their fur or in their feces, passing them to humans through close contact. 3. Contaminated food or water. Humans may accidentally ingest parasite eggs by consuming unwashed fruits, vegetables, herbs, or untreated water that has been contaminated with feces from infected animals. 4. Poor hygiene practices. Not washing hands after handling animals, gardening, or spending time in nature can lead to ingestion of parasite eggs. Children and those with frequent animal contact are at higher risk. Alveolar echinococcosis symptoms. Alveolar echinococcosis is a slow-growing parasitic disease, primarily affecting the liver. Symptoms may not appear for years after infection, but as the parasitic lesion grows, it gradually damages liver tissue and may cause the following signs. 1. Pain or discomfort in the upper right abdomen. As the liver enlarges, patients often feel pressure or dull pain under the right rib cage. 2. Loss of appetite and weight loss due to chronic inflammation and the body's ongoing immune response. Patients may experience reduced appetite and noticeable weight loss. 3. Low-grade fever. Some patients may develop a persistent mild fever, around 37–38 degrees Celsius, reflecting an ongoing immune reaction. 4. Fatigue and weakness. The chronic nature of the disease causes general fatigue, tiredness, and a lack of energy. 5. Jaundice, yellowing of the skin and eyes. When the growing lesion compresses bile ducts, bile flow becomes obstructed, resulting in yellow discoloration of the skin and sclera white of the eyes. Complications of alveolar echinococcosis. Without timely diagnosis and treatment, alveolar echinococcosis can lead to serious and life-threatening complications. 1. Liver failure. As the parasite invades liver tissue, it compromises liver function, potentially leading to liver insufficiency. 2. Bile duct obstruction, cholestasis. Compression of bile ducts can cause bile stasis, severe abdominal pain, and worsening jaundice. 3. Secondary bacterial infections. Necrotic or damaged liver tissues can become infected, leading to abscess formation or sepsis. 4. Spread to other organs, metastasis-like behavior. Although not cancer, eye lesions can invade other organs such as the lungs, brain, and kidneys, mimicking metastatic spread. 5. Risk of death. If left untreated, alveolar echinococcosis can be fatal due to progressive liver failure or multi-organ damage. Treatment of alveolar echinococcosis. Alveolar echinococcosis is a severe and potentially life-threatening parasitic disease. Treatment is complex and usually long-term. Here are the main approaches. 1. Surgical resection. The most effective treatment is complete surgical removal of the affected liver tissue. Even after surgery, antiparasitic medications are typically continued to prevent recurrence. 2. Antiparasitic drug therapy. Long-term use of albendazole is standard for patients who cannot undergo surgery or as a follow-up after surgery. Albendazole slows or stops the growth of the parasitic lesions. Treatment may last years or even lifelong in some cases. 3. Liver transplantation. In advanced or inoperable cases, liver transplantation may be necessary. This is rare but life-saving in severe disease progression. 4. Supportive and symptomatic care. Pain relief, infection control, and management of digestive symptoms may be needed. Regular imaging and lab tests are used to monitor the disease. Prevention of alveolar echinococcosis. This disease is zoonotic, transmitted from animals, especially wild and domestic canines, to humans. Preventive strategies are crucial. 1. Maintain strict hygiene. Always wash fruits, vegetables, and hands thoroughly. especially if they come from wild or unclean environments. Avoid eating raw produce gathered from soil contaminated by animal feces. 2. Treat pets regularly. Dogs and cats can carry the parasite. Deworm them every 3-6 months using veterinary recommended anthelmintics. Prevent them from scavenging or eating rodents. 3. Avoid contact with wild animals. Foxes and other wild carnivores are natural hosts of Echinococcosis multilocularis. Avoid direct handling of wild animals or their feces. 4. Drink safe water. Use filtered or boiled water, especially in rural or forested areas where contamination is possible. In conclusion, alveolar echinococcosis is not just a minor infection, it's a life-threatening disease that requires serious medical attention. Early diagnosis and treatment can save lives, and prevention starts with good hygiene and awareness. To our viewers, if you found this video helpful, please leave your thoughts in the comments. We truly value your feedback. Don't forget to like the video and subscribe to our channel for more reliable, science-based health information. Stay healthy and take care of yourself.